that's the case. I think it's the unfortunate fact that people of that age will tend to make the wrong decision and become sexually active whether or not they have access to birth control or prevention for spread of disease. And so, I think we have to make the call in the real world, and this is the call in the real world. I support the bill.
Thank you.
Thank you. We have a motion and a second. Would you like to close, Ms. Atkins?
I would just ask for an aye vote, and thank you for your time.
Thank you. This is a due pass and refer to Judiciary Committee. Ask the clerk to call the roll.
Monning?
Aye.
Monning, aye. Logue? Amiano? Atkins?
Aye.
Atkins, aye. Bonilla? Bonilla, aye. Ing? Garrick? Gordon?
Aye.
Gordon, aye. Hayashi? Hernandez? Aye. Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour?
No.
Mansour, no. Mitchell? Nastandi? Nastandi, no. Pan? Perez? Silva? Knight? Knight, no. Williams? Williams, aye.
That has 7. It needs 3. It'll stay on call. Thank you, Ms. Atkins. Members, just a time check here. We're on the home stretch. We have members Campos, Block, Hernandez, Mitchell, Pan remaining. I'm going to present now. I see Mr. Block is here. I need to present a bill in anticipation of some members' departures. We're going to get everybody in. Hopefully this one will be quick. I'm going to ask Mr. Nastandi if he'll please take the chair. Thank you, Mr. Nastandi, Chair, members. This is AB 922. This bill is consistent with the Federal Patient Protection Affordable Care Act, which significantly expands health care coverage to many uninsured people through public program expansions, a temporary high-risk pool program, a mandate to purchase coverage, and by requiring guaranteed issue of coverage. As we prepare to expand coverage to 4 to 5 million Californians currently uninsured, we need one place where healthcare consumers can access information about their health plans and providers and fix problems that might occur. California currently has a very fragmented system of consumer assistance for healthcare coverage complaints. There are 8 governmental entities and a number of private, nonprofit entities that provide assistance with public and private health care coverage. AB 922 will streamline the confusing and burdensome number of offices and agencies that exist to assist consumers. Approximately 3 million of the newly eligible population will qualify for Medi-Cal, and many of these people have had limited exposure to health care systems.
Ms. Lowenthal moves the bill.
Thank you. This bill will also help connect newly insured people with different language and cultural needs and integrate them into better understanding of their health care and health care system. AB 922 will allow the Office of Health Consumer Assistance to contract with existing community-based organizations that provide health consumer assistance at the local level. This will ensure that all clients are served in a culturally and linguistically appropriate manner. To ensure accountability to health consumers, this office is independent within state government and will collect data and publicly report on consumer complaints. In other words, this is both a consumer patient assistance line and eventually it will serve as a complaint line, a one-stop shop, if you will. I ask for your aye vote. I have some witnesses in support, Mr. Chair. Thank you.
Thank you, Mr. Chair. And Ms. Lowenthal did move the bill. And Ms. Mitchell, I assume that was a second with that? All right. There's a motion and a second. Testimony in favor of the bill?
Good afternoon, Mr. Chair and members. Vanessa Hino with the Western Center on Law and Poverty. We are proud to co-sponsor AB 922, which would consolidate a confusing number of state offices by creating the Office of Health Consumer Assistance. Unlike anything in existence in California today, this office would create a hub for connecting healthcare consumers to information, assistance, and referrals should they have questions or problems on getting health care. California is going to be expanding coverage to up to 4.7 million people starting January 1, 2014. Those who are going to be eligible for coverage in the newly formed exchange or in Medi-Cal are going to have a lot of questions and perhaps a lot of problems in terms of how to access health care. Many of the newly insured have not had access to health care in the past year or access to a regular medical provider. These are people who are going to need additional assistance in accessing care, answering questions, getting questions answered about their insurance coverage. AB 922 allows the office to contract with community-based organizations specializing in healthcare assistance to provide help to people in their communities. These organizations provide assistance in multiple languages through bilingual staff and can reach consumers who would otherwise not be seeking help. California needs one central place where people can go. This doesn't exist right now. AB 922 creates that office. We ask for your aye vote.
Beth Capel, on behalf of Health Access California, we're pleased to be here as the co-sponsor of this measure and also in support. We think that those of us who have insurance often find it difficult to figure out where to go to get help. If you have Blue Shield, who on earth regulates it? The Department of Insurance, the Department of Managed Health Care, or if your employer buys it as a self-insured plan, the Department of Labor. This would help all of us who have insurance know where to go when we need help. We've been very effective for the last decade in providing this kind of assistance to people who have HMO coverage at the Department of Managed Health Care. We know it can be done for 20 million Californians. Now we should do it for the other 15 million. And for that reason, we're pleased to support this measure.
Other witnesses, please state your name and organization and position.
Allison Lobb on behalf of California Children's Health Initiatives in strong support.
Hi, Julie Silas from Children's Defense Fund California and the 100% campaign representing Children's Partnership and Children Now, as well as PICO California, and we strongly support this bill.
Kathleen Hamilton with the Children's Partnership and the 100% campaign. We're in strong support. Appreciate your aye vote.
Bernie Palacios, National Association of Social Workers, California chapter, and we support this bill.
Dee Hamby with California National Organization for Women, and we support this bill.
Any testimony in opposition to the bill? Mr. Chair.
Thank you. Members would just respectfully ask an aye vote on the measure.
Thank you, Mr. And this motion is to pass and refer to the Appropriations Committee.
Monning?
Aye.
Monning, aye. Logue? Amiano? Atkins? Atkins, aye. Bonilla? Aye. Bonilla, aye. Ng? Garrick? No. Garrick, no. Gordon? Aye. Gordon, aye. Hayashi? Hernandez?
Aye.
Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? No. Mansour, no. Mitchell?
Aye.
Mitchell, aye. Nastandi? No. Nastandi, no. Pan?
Aye.
Pan, aye. Perez? Silva? Knight? Knight, no. Williams? Aye. Williams, aye.
Needs one more.
That's 9 votes. We need one more vote to move it out of committee.
Thank you, Mr. Nastandi. Thank you, members. And I will head right back up. Thank you, Mr. Nastandi, once again for chairing. We're going to go to Mr. Block on item 12, AB 1194. He will be followed by Ms. Campos, item 8. Thank you, Mr. Block. The floor is yours.
Mr. Monning broke the microphone. Turns me on, too.
April Fools. A few days late.
AB 1194 would conform existing statutes related to drinking water to the Federal Safe Drinking Water Act. The U.S. Environmental Protection Agency delegates its authority to California to implement a drinking water program. However, our program has failed to institute policies that are as stringent as the Safe Drinking Water Act. This bill addresses several deficiencies in state law. In California's laws or regulations, if these laws fail to comply with the Federal Safe Drinking Water Act, California may lose its federally delegated authority, which would result in the loss of several significant federal funds. The EPA could reduce or withhold the California Department of Public Health's annual Public Water System Supervision Grant of $6 million and its annual federal capitalization grant for loans and grants available to public water systems, which is currently $126 million. So this is a technical cleanup, common sense bill. I ask for your aye vote. With me here today is Lee Walker. She's Chief of the Division of Drinking Water and Environmental Management with the California Department of Public Health, the bill sponsor.
Now can you hear me? Great. Good afternoon. Thank you for the opportunity to be here. I am Leah Walker, and I'm Chief of the Division of Drinking Water and Environmental Management in the California Department of Public Health. And I would like to echo what the Assembly member just said and just state that AB 1194 will bring California laws into compliance with the federal requirements. And I'd be happy to take any further questions.
Thank you. Any other witnesses in support? Any witnesses in opposition? Seeing none, questions from the committee? Seeing none, would you like to close, Mr. Block?
I urge your aye vote, please.
Thank you. We have a motion and a second. This is a do pass and refer to Environmental Safety and Toxic Materials Committee. Clerk, please call the roll.
Monning.
Aye.
Monning, aye. Logue. Amiano. Atkins. Atkins, aye. Bonilla. Bonilla, aye. Eng. Garrick. Aye. Garrick, aye. Gordon. Aye. Gordon, aye. Hayashi. Hernandez. Aye. Hernandez, aye. Lowenthal. Lowenthal, aye. Mansour. Aye. Mansour, aye. Mitchell. Nastandi. Aye. Nastandi, aye. Ann. Perez. Silva. Knight. Knight, aye. Williams. Aye. Williams, aye.
That has 11. The bill is out. Mr. Block, thank you.
Mr. Chair. Thank you.
And members, what I'd like to do, here's, we're going to have Ms. Campos present item 8, AB 774, followed by Mr. Hernandez, Ms. Mitchell, and Dr. Pan. As Ms. Campos comes forward, I would like to entertain a motion on our consent calendar. It has one bill, AB 1014 by Mr. Fletcher. Is there a motion? I have a motion. Second. And many seconds. This is AB 1014 consent calendar. I would ask the clerk to call the roll, please.
Monning.
Aye.
Monning, aye. Logue. Amiano. Atkins. Atkins, aye. Bonilla. Eng. Garrick. Aye. Garrick, aye. Gordon.
Aye.
Gordon, aye. Hayashi. Hernandez. Aye. Hernandez, aye. Lowenthal. Lowenthal, aye. Mansour. Aye. Mansour, aye. Mitchell. Nastandi. Pan. Perez. Silva. Knight. Aye. Knight, aye. Williams.
I wish peanuts were included, but I'm an aye.
Williams, aye. We need one more.
That has 9. It will need one more. And thank you, Ms. Campos, for your patience. We're moving to item 8, members, AB 774. The floor is yours.
Mr. Chair and members, before I begin my presentation, I'd like to accept the committee's amendments reflected in the analysis. AB 774, as proposed to be amended, would give Department of Mental Health the same authority currently given to the Department of Public Health and the Department of Corrections to grant waivers for employing a clinical social worker in the process of obtaining licensure. It would also grant the 1-year extension for extenuating circumstances if certain criteria are satisfied. I respectfully ask for your aye vote.
Thank you. We have a motion and a second. Witnesses in support?
Yes, I do have witnesses in support. And if they may want to state their name and their position.
Janice Norman on behalf of the American Federation of State County Municipal Employees. I'll let my colleague do the majority of the testimony here to answer any technical questions.
Mr. Chair, members of the committee, my name is Cliff Tillman. I'm a senior business aide. Oh.
It's working.
Is it on? Oh, sorry. Mr. Chair, members of the committee, my name is Cliff Tillman. I'm a senior business agent for AFSCME. We represent well over 800 social workers in the state of California. And as the Assemblywoman just noted, there are one department in the state, DMH, Department of Mental Health, does not allow the same privileges that the other social workers have in other facilities, the right after 4 years in serving as a social worker, based upon insinuating circumstances, be allowed to request a 1-year extension. What this bill will do is allow them that right.
Thank you. Other witnesses in support?
Stephanie Burry on behalf of SEIU Local 1000 in support.
Thank you. Any other witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Committee member questions, comments? Seeing none. There's a motion and a second on the floor. This is due pass as amended and refer to appropriations. Ask the clerk to call the roll.
Monning.
Aye.
Monning, aye. Logue. Amiano. Atkins. Atkins, aye. Bonilla. Bonilla, aye. Ng. Garrick.
Aye.
Garrick, aye. Gordon. Aye. Gordon, aye. Hayashi. Hernandez. Hernandez, aye. Lowenthal. Lowenthal, aye. Mansour. Mansour, aye. Mitchell. Nastandi. Pan. Perez. Silva. Knight. Williams. Williams, aye.
That has 9. It needs one more. We're going to hold it till we get all our committee members back. Thank you very much, Ms. Campos. Members, we're moving to item 3, AB 185, presented by Mr. Hernandez. Good afternoon, Mr. Hernandez.
Good afternoon. Thank you, Mr. Chairman and members. Many women who are of childbearing age today find themselves without proper coverage for maternity services in their health insurance plans. Currently, health plans that are regulated by the Department of Health Managed Care provide maternity care. However, health insurance policies under the Department of Insurance are not required to cover maternity services. AB 185 would require new forms for health insurance policies regulated under the Department of Insurance to provide coverage for defined maternity services under California. As you may or may not know, preterm birth is the leading cause of newborn deaths in the United States. According to the Centers for Disease Control and Prevention, in 2008, 10.5% of all childbirths in California were preterm births. In particular, 57,770 of all preterm childbirths in the United States were in California. It is also significant to note that California has the highest number of all babies born with low birth weights, over 10% of the nation's number. Delaying access to prenatal and maternity care increases the chances of a poor outcome for the baby. We need to ensure that we provide access to quality maternity care and services to prevent birth complications and to ensure a healthy pregnancy for all women. Maternity services are critically needed services that provide for health and well-being of women and babies. These services are essential preventative care measures which will reduce future complications and health care expenditures. This bill would allow California to maintain its lead in the federal health care reform. Not only would AB 185 ensure fair and affordable access to quality maternity coverage in all health insurance policies, AB 185 would also serve as a bridge to the federal health care reform. This bill would provide a safety net until 2014, when the federal health care reform includes maternity care in its essential health benefits package. More importantly, this bill will ease in the price shocks that insurance providers would eventually face when the implementation of federal health care reform occurs in 2014. AB 185 lays down the groundwork for insurance providers to begin their work towards providing quality and affordable health care. Therefore, I respectfully ask for your aye vote.
Move the bill.
We have a motion and a second. Thank you, Mr. Hernandez. Witnesses in support?
Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists, District 9. We support this bill. We think also that there's going to be a lot of damage done between now and 2014 if this bill isn't signed. 6 years ago, 82% of policies had maternity coverage. 1 year ago was 18. Now it's 12. We can't wait till 2014. We ask for your aye vote.
Thank you. Other witnesses in support?
Dee Hamby for the California Organization for Women. And we support the bill. Good afternoon, Chair and committee members. We believe that 185 will bridge the gap and reiterate what Hernandez said between now and 2014, when thousands of children will be born without maternity coverage and care. Mothers and infants without maternity coverage have an increase of negative outcomes, and it will result ultimately in costing the taxpayers more money. Moreover, our state faces significant increases in health care costs from this lack of preventive care. Preterm and low birth weight babies average a medical cost of about $15,100 per birth versus $600 for full-term newborns. During this time of financial austerity, neither our families nor our state can afford this unnecessary cost. So we ask is your support of this bill.
Thank you. Now we'll take other witnesses in support. Name and organizational affiliation, please.
Thank you, Mr. Chair. Seth Bramble on behalf of the California Teachers Association in support of this bill. Thank the Assembly member for bringing forward this important issue.
Thank you. Beth Capel on behalf of Health Access California, also in support.
Linda Ross representing Kaiser Permanente in support.
Teresa Stark, California Medical Association in support.
Jason Vega with the Central Valley Health Network, which represents over 100 federally qualified health centers and 2.3 million patient visits, and we're in strong support for this very meaningful piece of legislation. Thank you.
Hi, Andrew Kiefer with Blue Shield of California. As a general rule, the company has been opposed to mandates, but for this one, we believe it's a fundamental health need that should be covered by all insurance companies. For that reason, we're proud to support the bill. Thank you.
Allison Ramey with the California Primary Care Association, representing the more than 800 nonprofit community clinics and health centers in support.
Brianna Pittman with Planned Parenthood Affiliates of California, also in support. Thank you.
Now, witnesses in opposition, please step forward.
Annie Owen with the Association of California Life and Health Insurance Companies, representing the PPOs that would be impacted by this bill. In general, and you'll see us up here a lot because for mandated benefit bills, we are opposed for the reasons that were stated previously, the impact cost on individuals as well as the impacts on the health insurance exchange. For this bill, however, I want to just raise a policy issue for you because we know that maternity benefits will be part of any essential benefit package. So it's going to be coverage that everyone's going to get. The public policy issue I want to raise with you is just the fact that in 2014, when folks get those essential benefits through the exchange, they will also get a subsidy to help them pay for the cost. And so the public policy issue before us is whether or not it makes sense to force people to buy it now when it can have an impact of more than 9,700 people may be losing their coverage altogether. It's a total of, I think, $22 million added on and maybe a 28% increase. And so even though we don't have any problems with the importance of maternity benefits and would certainly agree with everything that the proponents had said, as well as the fact that one of our members supports this bill, Blue Shield. On behalf of our other members, we do want to raise the serious concerns we have about just the cost impacts on people before they can get a subsidy to cover it. Thank you.
Thank you.
Marty Fisher, in opposition on behalf of the California Chamber of Commerce. And again, we're opposed to benefit mandates because they raise the cost of coverage. And the more you raise the cost, the fewer people that can afford it. And this is only one of at least a dozen or more benefit mandates that you're going to see this year. And we need to look at that in totality and see how many people will lose their coverage altogether because they can't afford it when we add all these benefit mandates onto it. Thank you.
Thank you. Other witnesses in opposition? Committee member questions? I've got Mr. Garrick and Mr. Mansour. Do you have a? No.
I won't ask Mr. Hernandez if this is your first bill, but on another question relating to this, you're going to mandate maternity services for all health insurance policies in California. Is that correct?
No, that's not correct. This bill would seek to address policies regulated by the California Department of Insurance, which represents approximately 17% of privately funded insurance plans subject to California regulation.
Well, what is the situation? Let me give you a hypothetical. And what effect would your bill? We recognize that when we create mandates, I'll open up with a statement that, and mandated expanded coverage, that it's going to cost more. Would you agree with that?
It's already costing more today as a result of not having the care.
Not today. I'm just asking the straight question. Would you agree that when we expand coverage, that it's going to add to the cost of?
I would agree that everything has a cost, but I think ultimately the implementation of this would ultimately, long-term picture, reduce latent costs that come as a result of not having this care as a standard base.
Now, it seems that we are increasing medical costs here unnecessarily, and it seems that certain individuals may want to elect not to have mandated coverage as it relates to maternity if they don't intend to get pregnant, if they either a husband and wife as a collective couple or a husband working for one company and a wife with the other may elect to select a certain insurance program individually or separately for their own needs as they may find suitable. And again, I think this is an example of us trying to micromanage and expand coverage into areas where the free market seems to be fulfilling those needs, and I'd encourage you to reconsider this. I know it's well intended, but mandating maternity coverage in this case, I think, is unnecessary. The bill similar to this has been vetoed 4 times in a row because of the recognized expanded costs and the fact that it will have on the free market as it relates to individuals who will be forced into a position of not being able to afford, because of the increased coverage, a health program.
It has been vetoed before by I think a governor that has been characterized by California citizens as an insensitive and maybe lacking knowledgeability on this issue. But it has passed through the legislature on multiple occasions, and I'm confident will be signed by the governor this year.
Thank you. I have Mr. Mansour next. Mr. Garrick, are you? Thank you. Thank you. Mr. Mansour?
Thank you. I actually had a question for the representative from ACLIC. There was a comment that was made about coverage for this that's in effect going down, that there's less coverage available. And I just want to, maybe I misunderstood that, but this coverage is available under some plans if some people want it. Is it readily available?
All of my health insurance companies in the individual market offer several plans that include maternity. On the insurance code side of things, they don't, people don't have to buy a product that includes it, so they sell many times both types of products. But all of my members do sell it. It's just that folks don't have to buy a product that includes it.
Okay.
There are those 2 options on the market.
I just wanted to confirm that the coverage was there if someone wanted it, and it's readily available. Thank you.
Thank you, Mr. Mansour. Seeing no further questions, we do have a motion and a second. Would you like to close, Mr. Hernandez?
I think ultimately we have to look at this bill as closing that very small population of bills and patients that have medical insurance plans that don't cover this very basic coverage element. We're talking about 13 to 17% of those women that have health insurance. It's not the majority. It's not the supermajority. It's a very small minority, but it does help to close a gap, and it does help to save the lives of newborns and allows for a process of a healthier pregnancy for women going through the process.
Thank you, Mr. Hernandez. We have a motion and a second. This is a due pass and refer to appropriations. Ask the clerk to call the roll.
Monning?
Aye.
Monning, aye. Logue? Amiano? Amiano, aye. Atkins? Atkins, aye. Bonilla? Aye. Bonilla, aye. Eng?
Aye.
Eng, aye. Garrick?
No.
Garrick, no. Gordon?
Aye.
Gordon, aye. Hayashi? Hernandez?
Aye.
Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour?
No.
Mansour, no. Mitchell?
Aye.
Mitchell, aye. Nastandi? Pan?
Aye.
Pan, aye. Perez? Silva? Knight? Williams? Aye. Williams, aye.
That is 11. The bill is out. Thank you, Mr. Hernandez.
Thank you very much. Thank you, members.
Members, just Ms. Mitchell, as she makes her way forward, this is item 4, AB 389. She'll be followed by our final presenter today, Dr. Pan, on item 7. We do have a number of bills on call. I would ask members who aren't currently here in chambers if you want to make your way down to participate in these last two presentations, and we'll keep the roll open for a bit after these presentations. But I would urge members to get here who have not voted on prior bills. And Ms. Mitchell, thank you for your patience this afternoon. Item 4, AB 389. The floor is yours.
Thank you, Mr. Chair and members. Thank you for the opportunity to present to you AB 389. It would establish standards of service for pharmacies that deliver blood clotting products and related equipment for home use to people who have hemophilia and other blood disorders. This bill brings parity to the handling standards for these life-saving products. While pharmacies that provide clotting factors to patients on various state-funded programs must indeed comply with standards that are included in written contracts with the state, currently there are no standards in state law that governs the proper storage and delivery of blood clotting products for private pay patients. Again, members, it's a parity issue. The lack of handling standards has resulted in some patients enduring difficulties in receiving these life-saving products. For example, clotting factor has been left on patients' front porches by various pharmacies, resulting in spoilage due to the heat. These are very costly products. Here with me today to discuss some of the issues related to this bill are Tony Maynard, a patient, and Terry Calgar-Hill, representing the sponsor of the bill, the Hemophilia Council of California. I respectfully ask for your aye vote.
Thank you. Mr. Chair and members, Terry Calgar-Hill on behalf of the Hemophilia Council of California. We are the sponsors of this important measure to provide standards for patients with hemophilia and other blood clotting disorders in the home setting. We've worked very hard to make sure that this bill is cost neutral, that we worked with a large variety of partners, including the manufacturers who make clotting factor, the pharmacies who deliver the clotting factor to the patients, the medical community, and the families and patients. And I have with me our board advocacy chair, Tony Maynard, who is a patient with hemophilia, who can share the reasons why we need this important measure.
We have a motion and a second. Other witnesses in support? You may proceed with your testimony, but you can
I will keep it
be
brief.
concise.
I understand it's been a long day. I just want to say thank you, first of all, for hearing the bill and for moving it so far. My name is Tony Maynard. I am a person with severe hemophilia. I was born before there were any treatments of hemophilia. I have some damage because I had no medicine available when I was young. But in reality, I shouldn't be alive because this medicine is critical. And this medicine is critical for not just our survival, but also our ability to maintain a healthy body and continue to work and be productive citizens. I have a job. I have health insurance through my employer. And I feel that it's a little unfair, the system that we have currently, where we have a different set of standards for state pay patients, and I like to see the same standards for private pay patients, such as myself. I think you probably know the history of hemophilia a little bit to know that we were relying on the blood supply. We had a devastating impact on our community from HIV and hepatitis C. I was infected with both. My brother died of AIDS. And we're very protective of our product, consequently, because of these kinds of things. We want to make sure that not only are the products safe when they get to us, but that they're usable and there's not waste in the medical system. So I encourage you to please support the bill.
Thank you for sharing both your testimony and your story. Much appreciated. Other witnesses in support?
Les Shepard representing CSL Bearing in support. It's also important to note that this bill has not received opposition. Thank you.
Mr. Chairman and members, John Valencia representing Talecris Biotherapeutics, a blood factor producer, and we support the standards in the bill. Thank you.
And David Gonzalez on behalf of the Plasma Protein Therapeutics Association in strong support.
Teresa Stark with the California Medical Association in support.
Peter Kellison for Walgreens, which has a specialty pharmacy operation and provides support for this product and supports the bill.
Thank you. Any witnesses in opposition? Seeing none, any questions from committee members? Seeing none, we have a motion and a second with a do pass and refer to appropriations. Clerk, I'm sorry, I didn't afford you a chance to close, Ms. Mitchell.
Just very briefly, Mr. Chair, this was a double referral. We were heard in business professions. We got out of that committee. And again, what's critical about the parity issue around these standards is the timely access to these blood clotting agents is very critical for people who need them. To be able to access them at home quickly at a high standard is very important. That's why I carried the bill, and I ask for your aye vote.
Thank you for carrying the bill, Ms. Mitchell. And now I'll ask the clerk to call the roll.
Monning?
Aye.
Monning, aye. Logue? Amiano? Aye. Amiano, aye. Atkins? Atkins, aye. Bonilla? Aye. Bonilla, aye. Ng? Aye. Ng, aye. Garrick? Aye. Garrick, aye. Gordon? Aye. Gordon, aye. Hayashi? Hernandez? Aye. Hernandez, aye. Mansour? Aye. Mansour, aye. Mitchell? Aye. Mitchell, aye. Nastandi? Aye. Nastandi, aye. Pan? Pan, aye. Perez?
Did you call out Lowenthal? She didn't hear her name called.
Lowenthal? Lowenthal, aye. Silva? Knight? Williams?
That has 13. The bill is out. Thank you, Ms. Mitchell. And last but not least, Dr. Pan presenting AB 678. This is item number 7, members. And if members are within earshot who are not in the committee room, I would encourage you to please join us as we are on the home stretch here. Dr. Pan, thank you. The floor is yours.
Okay, thank you, Mr. Chair and members. I want to present to you Assembly Bill 678, which is a measure to help local governments offset some of the costs providing emergency medical transport to Medi-Cal enrollees. Now, what we do know is that Medi-Cal reimbursement rates for ambulance services, like that for other provider services, whether it's hospitals, nursing facilities, mental health programs, clinics, physician services, have not really kept pace with the cost of actually providing the service. Thank you. However, with other programs that currently draw about $400 million a year for federal reimbursement funding for local and state providers, only ambulances program is the only program that doesn't actually get that kind of funding. So AB 678 is modeled after other supplemental reimbursement programs designed for these other provider services to obtain increased federal financial participation. And we certainly know in these budget times we want to try to, given the fact that we actually are a contributor state, we want to try to draw in all the federal support we can to help support our local services. So this bill would allow local government entities to claim federal financial participation using certified public expenditures. And in fact, these expenditures have been very successful mechanism for obtaining federal financial participation. So this bill is co-authored with Senate President Pro Tem Darrell Steinberg. It's sponsored by the California Professional Firefighters and supported by the California Fire Chiefs Association and the Fire Districts Association of California. So I have here with me today to testify in support of the bill are Christy Boma from the California Professional Firefighters, Interim Fire Chief Kurt Henke from Sacramento Metro Fire. Okay. And, all right. So thank you so very much.
Thank you, Dr. Pan. Witnesses in support.
Mr. Chairman, members of the committee, Christy Baumer representing the California Professional Firefighters, pleased to be the sponsors of this measure. I could just briefly say that there are federal dollars on the table, and absent this bill that gives state authorization so that local agencies can participate in the program, this money is left on the table, and the safety net services provided by fire departments go unfunded or underfunded. We ask for your support.
Thank you. Other witnesses in support?
Kurt Henke, Fire Chief, Sacramento Metropolitan Fire Protection District. I can't echo it any better. There are federal dollars on the table. In these tough economic times, we've had employee groups take massive concessions. We've still had to close 3 fire stations. What it means to our fire department is basically it would be enough revenue to reopen one of those closed fire stations on an annualized basis. So we urge and support the passage of this bill. Thank you.
Mr. Chairman, members, Ralph Heim for the California Fire Chiefs Association, the Fire Districts Association, in support, and I'll allow the gentlemen and ladies behind me, if they could, Mr. Chairman, to indicate their support as well.
Thank you. And witnesses in support, please identify yourself by name and organizational affiliation. Thank you.
Hi, Chief Bill Daniels, Metro Fire Department, and I support this bill.
Vince Webster, City of Fairfield Fire Department. I support this bill.
Frank Drayton, Vacaville. I support this bill.
Tracy Hansen, Fire Chief, Cosumnes Fire Department, serving the citizens of Elk Grove and Galton, Southern Sacramento County, and I'm here in support of the bill.
Richard Pierce, Fire Chief, Tiburon Fire District, strong support on behalf of the Marin County Fire Chiefs Association.
Jeff Myers, Assistant Deputy Chief, Chief of Emergency Medical Services, City of San Francisco Fire Department. We definitely support this.
Mike Stone, Fire Chief with Kelseyville Fire Department, along with the Lake County Fire Chiefs Association, in strong support.
Chief Ted Peterson from the Novato Fire District. We're in strong support of this bill. Thank you.
Joel Slaughter on behalf of North Tahoe Fire Department. We support the bill.
Rusty Dupre from Sacramento Metropolitan Fire. We support this bill and encourage an aye vote.
Thank you. Any witnesses in opposition? Seeing none, I want to thank those in uniform both for your service and for taking time to be here today. Thank you. Any questions or comments from committee members? Seeing none, we have a motion and a second. This is a due pass and refer to appropriations. Dr. Pan, would you like to close?
I just again want to thank all the fire chiefs and firefighters who took time out of their busy day to sit here in committee hearing. And again, I urge your aye vote. Thank you.
Thank you. Clerk will call the roll.
Monning?
Aye.
Monning, aye. Logue?
Aye.
Logue, aye. Amiano? Aye. Amiano, aye. Atkins? Atkins, aye. Bonilla? Bonilla, aye. Eng?
Aye.
Eng, aye. Garrick?
Aye.
Garrick, aye. Gordon?
Aye.
Gordon, aye. Hayashi? Hayashi, aye. Hernandez?
Aye.
Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? Aye. Mansour, aye. Mitchell?
Aye.
Mitchell, aye. Nastandi? Nastandi, aye. Pan?
Aye.
Pan, aye. Perez? Silva? Silva, aye. Knight? Williams?
That has 16. The bill is out. Thank you, Dr. Pan. Now, members, we have 5 bills on call. I'm going to ask the clerk to do a roll call on each of those for absent members. And then after we get through that, members who have missed votes can add on with the clerk. I'd like to start with item 10, which is the consent calendar. I would ask the clerk by Mr. Fletcher. This is 1 vote short. I'd ask the clerk to read absent members to vote on consent calendar.
Logue? Aye. Logue, aye. Amiano? Aye. Amiano, aye. Bonilla? Bonilla, aye. Eng? Eng, aye. Hayashi? Hayashi, aye. Mitchell? Mitchell, aye. Nastandi? Nastandi, aye. Pan? Pan, aye. Perez? Silva? Silva, aye.
That is 18 consent calendars out. Now we're going to go in file order. We have 4 remaining that are on call, starting with item 5, AB 499 by Atkins. Ask the clerk to call the roll of absent members, please.
Logue? No. Logue, no. Amiano? Aye. Amiano, aye. Ing? Aye. Ing, aye. Garrick? No. Garrick, no. Hayashi? Aye. Hayashi, aye. Mitchell? Aye. Mitchell, aye. Pan? Aye. Pan, aye. Perez? Silva? Aye. Silva, aye. That's 13.
That is 13. The bill is out. Now we're going to move to item number 8, AB 774 by Ms. Campos. Ask the clerk to read absent members, please.
Logue?
Which one is it again?
Item 8, AB 774.
Logue, aye. Amiano? Aye. Amiano, aye. Ing? Aye. Ing, aye. Hayashi? Aye. Hayashi, aye. Mitchell? Aye. Mitchell, aye. Nastandi? Aye. Nastandi, aye. Pan? Aye. Pan, aye. Perez? Silva? Aye. Silva, aye. Knight? Aye. Knight, aye. That's 18.
How many?
18.
That has 18. The bill is out. We move now to item number 9, AB 922 by Monning. Ask the clerk to call the roll.
Logue? No. Logue, no. Amiano? Aye. Amiano, aye. Ing? Aye. Ing, aye. Hayashi? Hayashi, aye. Perez? Silva? No. Silva, no. That's 12.
That has 12. That bill is out. And our last one on call is item 11, AB 1059 by Mr. Huffman. Ask the clerk to call the roll of absent members.
Logue? Logue, no. Amiano? Aye. Amiano, aye. Ing? Aye. Ing, aye. Garrick? No. Garrick, no. Gordon? Aye. Gordon, aye. Hayashi? Hayashi, aye. Lowenthal? Perez?
This one. Let me
Knight?
get through.
Knight, no.
Okay, I have a vote change on this bill by Huffman, AB 1059. Mr. Nastandi? No to not voting. Clerk has recorded that, and our count.
I'm sorry. 11.
We have 11 on AB 1059. The bill is out. Okay, members, before you rush the clerk, what I'd like to recommend is, first I want to thank members who patiently worked with us through the afternoon. Now what I will do is have the clerk up here go through, starting with item 1 was pulled, starting with item 2, and allow members to add on. We'll go in sequence. I'll ask the clerk to inform members which bill you're working on. Thank you.